Alrighty, thank you all so much for joining us today for our Countdown to Rare Disease Day 2026 launch webinar. Very excited to be here with all of you launching the 2026 Rare Disease Day campaign. This is one of my favorite webinars of the year. Before we get started, I have a few housekeeping related items. One big item is that if you have any questions, please submit them through the Q&A function at the bottom of your Zoom window. That will be super important. We want to make sure all of your questions get properly cataloged and answered, and we will not be able to keep track of them in the chat. We have this amazing, interactive, robust chat going on, and it's very likely we'll miss your questions. That said, if you'd like to interact with other attendees, please use the webinar chat function for that. If you're just joining us, please feel free to introduce yourself, tell us where you're from, your connection to rare disease. And I also want to kind of set the stage for what we're trying to achieve during this virtual event. It's being hosted by NORD, the National Organization for Rare Disorders. We are a nonprofit organization based in the US, and we are the US sponsor for Rare Disease Day. So our goal is really to make sure that all of you understand how you can participate in celebrating Rare Disease Day along with us and along with all of our global partners. So to introduce the global campaign, we actually have somebody joining us from EURORDIS, and I'm super excited about that. And before I turn it over to Rhia, I am going to share my screen, go through the agenda, and also launch a quick poll. I would love for all of you to fill it out. We have a few polls throughout this webinar because we want to hear from you, and we want to hear how you envision participating in Rare Disease Day. So the first poll is called Getting Involved with Rare Disease Day. I am launching it now. You should see a question pop up on your screen. I can see a lot of people are already participating. So I'll leave that up for a few moments and I'm going to share my screen. Alrighty, you should see my screen. I'm going to go to the next slide. This is our agenda for today. I've already welcomed all of you. Welcome and thank you for your time. Rhia is going to walk us through the Global Rare Disease Day campaign. I am going to walk us through the US Rare Disease Day campaign, and we'll talk about a few different activations and ways to engage with the campaign here in the US. And then we will wrap up with a Q&A session at the very end. So with that, I'm super excited to turn over to Rhia Walls. Rhia is a communications manager and the Global Rare Disease Day lead at EURORDIS, Rare Diseases Europe. And this image that you see on your screen is actually Rhia and I. Rhia was in the United States about 2 weeks ago and came to our New York City Marathon cheer section. And we were joined by Nordy, Nord's mascot. So if you're participating in in-person Rare Disease Day activities, you may get the opportunity to meet Nordy in person. And for those of you, I know that there's probably some people joining us from countries outside of the US. Maybe you'll get to meet Rhia. If you're Europe-based, I'm sure she will be in the community in February and certainly in the days leading up to Rare Disease Day. So I'm going to stop sharing my screen and give Rhia the opportunity to share some slides.
Thank you so much, Darby. And yes, it was such a pleasure to meet everyone at the marathon and also to meet Nordy as well. What a privilege. So yeah, if you were there, hello again. It's lovely to see you. And to all of those of you who don't know me, yes, I'm Rhia Walls. I work for EURORDIS here. I'm based in Paris, but I am now here in my capacity as the global coordinator of the Rare Disease Day campaign. So just briefly, I personally today am going to walk you through from the very basics. So what is Rare Disease Day? Then I'm going to introduce the Global Rare Disease Day campaign for 2026. And then we're going to get into the really important stuff. How can you get involved? And here I've got listed individuals and organizations, but organizations is both patient organizations and also companies. So without further ado, what is Rare Disease Day? as I'm sure many of you are aware, if you've gotten to this point, Rare Disease Day is the global awareness raising movement for individuals living with a rare disease. It has been going since 2008 and it is coordinated by myself and the Rare Disease Day team here at EURORDIS Rare Diseases Europe, in alliance with over 70 national alliance partners worldwide, one of which obviously is Nord. And we couldn't do what we do without them. We are incredibly grateful for all of their support. And the main objective of the campaign, our main goal, is equity. And that is equity in social opportunities, in healthcare, in access to diagnosis and therapies, really equity in any sense that people living with a rare disease feel that they need to fight for equity in their local, regional, national, whatever it may be, communities. And how does the campaign reflect this? So our 2026 campaign kicked off, well, launches today, officially 100 days to Rare Disease Day. And you can see here one of our lovely posters featuring Micah, who is actually from the United States. And he is one of our four campaign heroes, or four sets, should I say. Two of them are a set of siblings, so there are actually five heroes in total. From left to right, listed along my screen here, we have Aicha and Burak, who are from Turkey. As I said, we have Micah, who is from the United States. We have Linez, who is from Malaysia, and we have Mac, who is from France. These lovely heroes are completing our set of heroes that we've been working on for the last 2 years. So if you're familiar with the campaign for 2025, we featured four heroes from different world regions, and these four complete the world regions that were not represented by last year's campaign. And I'm thrilled to say that we are building on the work of the Rare Disease Day campaigns that have gone before us. We are keeping all of our branding. We are keeping, most importantly, our More Than You Can Imagine slogan, which was launched last year and had incredible feedback from across the community. So thank you if you used it. Thank you if you, made it the center of your campaign actions. We really appreciate your support and anything that you did to feature that message. And really, this year, our focus is on breaking down the concept of equity. Because after conversations with people, again, across the community and people, National Alliance partners involved in the campaign, that really was kind of the sticking point that people that seemed to come up the most often was that people don't necessarily understand what equity is on a practical day-to-day basis in their everyday lives. And so that really is the goal of this year's campaign. And here you can see exactly how we are doing that. So this year we are encouraging people to, as usual, adapt the campaign in this kind of decentralized manner to their local or national contexts, and really in this capacity to say what equity means to them, what equity means to you and to your communities and to your rare disease experience. Here is just a few examples of how you can use the kind of more than you can imagine concept in which to do that. And I think we're going to come back to this later and kind of have a discussion about maybe what Nord is going to be doing in the United States, but also get you inspired for what you could do on a local level wherever you are based. Our campaign approach this year has really been to repurpose what we have and make things more accessible than ever, in more languages than ever. So really kind of making our resources available to people wherever they are and, whatever rare disease they are living with. So all of our campaign resources, which I will go through a little bit in a second, are now available in accessible and editable formats on our website, which has also been redesigned and fixed so that hopefully things should be more navigable than ever as well. We're also tackling the English language dominance amongst the campaign. So our lovely campaign video launches today and has launched across the world in a variety of different languages through our national partners, again, one of which is Nord. So thank you very much to you if you have seen the video, and if you haven't, please go and give it a watch. We also have a podcast mini-series called Rare Runner Stories, which will be releasing every other week between now and Rare Disease Day, featuring stories from across our community all over the world to really highlight the diversity in terms of both people and also experiences in the rare disease community. I'm also thrilled to announce that last year's capacity building webinar, so we held two. The first you can see here featuring our lovely experts was about enhancing accessibility in both physical and digital spaces. And the second one was about how to engage healthcare professionals in your campaign activities, are now both available in bite-sized chunks on YouTube in 12 languages. So I would highly recommend that you go and watch those back, because really our experts had some amazing advice and really interesting things to say. And finally, all of our resources resources are available in multiple languages. Like I said before, they're also available in an accessible and editable format through Canva, so that they can be produced in even more languages again going forward this year, and add to that list of available translations. This is kind of, I will say this a few times, so I'm sorry if I sound like a broken record by the end of the webinar, but if you do happen to translate any of our resources, please get in touch with myself and the team here at EURORDIS, because we would absolutely love to make your translation available to more people across the world. To give you a bit of an idea of where we are in the campaign timeline, again, myself and the team spend most of our summer creating the resources that are now available. We spend our September kind of finalizing and uploading and translating them. We held our launch webinars in October in preparation for today, which is obviously the launch day, the 20th of November, in preparation for the 28th of February 2026, which is Rare Disease Day itself. And I'm also thrilled, I'm just going to speak on this very quickly to give you kind of a sneak peek at the Raising Youth Voices project, which is something that is new to Rare Disease Day 2026 this year. And Rare Disease Day is holding, shall we say, in collaboration with both NORD and RDI, Rare Diseases International. And I'm really excited about this project. We're going to be bringing youth voices from across the world together for a roundtable in Barcelona in February of 2026, which we'll then hopefully be able to film and release and make public for Rare Disease Day. And the goal of this, like I say, is really to center youth voices in the campaign in a way that has never been done before. Unfortunately, it is too late to apply to be a regional representative. However, if you are interested in learning more about this project, please stay tuned, and I can only encourage you to get involved with the regional kind of projects and the regional conversations that will be going on as part of Raising Youth Voices once the project really gets kicked off in the next few weeks. So, how can I get involved? Firstly, if you're an individual looking to get involved in Rare Disease Day, perhaps the most straightforward is to join the campaign digitally on social media. Please use the hashtag Rare Disease Day without the year on the end, so not Rare Disease Day 2026, just Rare Disease Day, because that really helps us demonstrate to people the historic momentum that the campaign has, and really helps people to see just how many people across the world every year are talking about Rare Disease Day. And we don't lose that momentum every new year. We also ask if you would like us to share your post, to tag us so that we can see it and we can share it. And I also encourage you to keep an eye out for our annual Instagram challenge, which will be taking place on our Instagram stories in February, and is always a great moment of both community and of unity across the globe. You can also use our website to find and attend a local event, which I'll speak a little bit more on at the end. And again, you can light it for Rare at home. I'm going to leave Darby to talk more about Light It for Rare, as I think they have some specific advice for how they recommend getting involved with Light It for Rare here through NORD. So without further ado, organisations, what can you do? All of our posters, all of our flyers with our heroes on are, again, as they were last year, available in an adaptable and translatable format. Here you can see some absolutely lovely examples of how they were used last year by the Alpha One Foundation here in the United States to highlight their community and the messages that matter to them. And we really encourage you to do this as much as you can. And in this instance, specifically this year, to adapt the More Than You Can Imagine slogan to your community and to your fight this Rare Disease Day, really. We also encourage you to have a look through all of our toolkits. We have several toolkits, and we have our equity toolkit, which gives you everything that you need to know to start having those all-important conversations about equity and explaining equity to people outside of the rare disease community, what that means and why it's important in a whole variety of contexts. We have our Light Up for Rare toolkits, which again has got some super helpful practical advice in whether you're looking to light it for Rare just at home or a local monument, for example. And finally, we have our school toolkits as well. We have 4 school toolkits, one designed for 4 different age groups, each with kind of a lesson plan and age-appropriate activities to help explain what rare disease is, Rare Disease Day, and also equity are to children in schools. If you're holding an event, you can also post your local event on our map on our website, which I will show in just a second. You can also get involved in lighting up for Rare on a slightly bigger level, so lighting up maybe a local local monument or an office building or something like that. And finally, you can coordinate with your national alliance. I really can't stress this one enough. Um, Rare Disease Day is a moment of community. It is a global moment for the rare disease community to shine, and to really come together. And by coordinating our actions at both local, international, well, local, national, and international levels, that really allows us to kind of make our voices as loud as they can be. I'm just going to minimize my screen and go to the Rare Disease Day website and show you where you can find some of the things that I have been talking about. So you will see here our resources menu, which is split into branding, social media, media, and toolkits. Branding is all of your basic information about our logo and our colors. Social media is all of our social media designs in all of our languages. The page I'm going to show you right now is media, as this is, I think, the least self-explanatory. But this is where you can find the virtual background that I'm using right now for all of your Zoom calls, even if it's just to, get that conversation started. An email signature, a flyer, which just has general information about Rare Disease Day, and our beautiful posters featuring our campaign heroes that you can also use in an editable format and feature your own community members on, as I just showed on the slide. And perhaps the other most important is the map, our event section. So you go to the Get Involved menu. Obviously here you can see we have Raising Youth Voices, we have Share Your Story, which allows you to share your story on the Rare Disease website. And then we have Find Events Near You or Post Your Event. So if you go to Find Events Near You, you can find our interactive map of all of the events that will be happening for Rare Disease Day. Of course, it's a little bit sparse at the minute as people are still in kind of planning phases of their events. So we're looking forward to this being populated in the coming weeks. And if you're an organization looking to post your event, again, you go to Get Involved, you go to Post Your Event, and then you just fill out this simple form. And myself and the team will upload it to the website for you. If you have multiple events going on, please get in contact with us. I'll leave my email address at the end, and we can send you a spreadsheet so that you don't have to fill this form out for every single individual event going on in your local area, and you can do one form or one spreadsheet for the mass application of events. So if I return to my slides, I'm now just going to talk very briefly for companies, as I'm aware there are a few company representatives as well joining us today. As I was just saying about national alliances, really our advice to companies is to go and listen to your local patient groups and support your patient organizations. Rare Disease Day is a patient-centered movement. It's about amplifying the patient voice. And so really the most important thing that you can do is listen to them and help them amplify their voice and achieve their goal, whatever that may be, however they are fighting for equity. As an example, these are some of we have many, many ways that companies get involved with the campaign, and it's always amazing to see every year. But you can see a list down the end there of, organizing walks and marches, becoming an internal ambassador by holding roundtable discussions or webinars within your organization, holding external events, including forums, conferences, press conferences. You are also more than welcome to join the Global Chain of Lights, which is what the Light Up for Rare movement is a part of. And again, Darby will speak more on that later. And finally, also, obviously, on a personal level, we really encourage you to join the campaign digitally and to add your voice on Rare Disease Day to amplify the movement even further. A very quick note on the Rare Disease Day logo. Again, this is primarily aimed at companies. So if you are a patient or an individual, a patient organization, sorry, or an individual, don't necessarily worry about the specifics of this too much. But our Rare Disease Day logo is a registered trademark, which is owned by EURORDIS. And therefore, we do ask, as a symbol of the global partnership that it represents, that it is only used in the way that it is intended. And therefore, we ask no commercial entity to insert, list, or display their logo alongside the Rare Disease Day logo. And the same logic is applicable for all of our editable resources. You're more than welcome to use our resources, but we do ask that you use them as you find them, rather than editing them to feature your own community, etc. If you have any questions about this, please don't hesitate to get in contact with me, or you can also find a full set of guidelines on our website. Again, or if you're familiar with the work of EURORDIS, our lovely fundraising team with our fundraising director, Celine Schwab, will be more than happy to answer your questions. Thank you very much. I think I've spoken for for more than enough time. Again, that is my email address or the email address of my team if you are looking to get in contact with any specific questions that I maybe haven't answered here today. And so, yeah, on that note, I hand over to Darby to find out more about what will be going on with Nord and in the United States.
Thanks so much, Rhia. And people who have questions for Rhia, you're welcome to submit them through the Q&A tool. She'll be here during the kind of US campaign portion of the presentation, and we'll be here when we open it up for live Q&A. So you're welcome to do that. And then she also said she'll put her email somewhere after, likely in the chat. So there's ways for you to get in touch with her and ask her follow-up questions. Alrighty, so I'm going to reshare my screen. Back to Rhia and I. The next slide is actually the video that Rhia mentioned. It's the 2026 Rare Disease Day official campaign video, and we're going to watch it. It's a really lovely video, and I just want to highlight that Micah Claiborne, who Rhia mentioned, is featured as our North American representative in the video. Micah is from Texas, and he lives with a rare condition called Dannon's disease. So with that, I'm going to go to the next slide and enjoy.
What is it like to live with a rare disease?
I have to take care of my conditions while dealing with how the others look at me.
I deal with an educational system that ignores me.
I face discrimination and a lack of acceptance.
I feel the need for action and access, not apologies.
But things can be different. I imagine a brighter future where empathy replaces judgment. Healthcare is inclusive. Public space fits everyone's needs.
And no one is left behind.
More opportunities. More hope.
More breakthroughs.
More action. More community. More than you can imagine.
A part in Rare Disease Day.
All right, I hope everybody enjoyed the video. Please, I'd highly encourage you to share it. You know, you can mark this 100-day kind of countdown moment to Rare Disease Day across your own social channels, social media, with your networks, with your family, friends, anybody that you're connected to. You can let them know we are officially at the 100-day mark. And as Rhia mentioned, that video is available in many, many different languages, and you can head to the Rare Disease Day campaign website to find it. So moving on, we're going to transition a little bit into the US Rare Disease Day campaign. NORD is the official US sponsor for Rare Disease Day, and I have just a few key facts to kind of help kind of provide context into how we work really closely with EURORDIS on this campaign. So as Rhia mentioned, NORD is a national alliance. We participate on the Rare Disease Day Steering Committee, and we really get this amazing opportunity to both inform the campaign at the global level and then bring the campaign to the United States and drive it here at the regional level. And we share the same vision. And our vision is that Rare Disease Day holds the promise that together we can join hands to advocate for equitable access to diagnosis, treatment, care, and social opportunities for the 300 million people living globally with rare diseases. And in the United States, that's 30 million people. So now I have another poll. As we know, equity is the sole focus of the Rare Disease Day campaign, and we really want to know, what does equity mean to you all? What does equity for people impacted by rare diseases mean to you? So I'm just going to launch my poll here. Alrighty, we'll give everybody a moment to answer this. It's a short answer poll, so you'll need to type in a word and you should see it on your screen. I know this one takes a little bit more time to think about, so I'm going to leave it open and I'm going to keep going. All right, and I'm going to transition into the part of our presentation that focuses on tools, resources, and opportunities that NORD provides to everybody to make it very easy to get involved in celebrating Rare Disease Day. And like I said at the start, that's really our goal. My hope is that each and every one of you will leave this webinar with an action heading into Rare Disease Day 2026, whether that be heading over to our Faces of Rare dedication wall or submitting information on your own Rare Disease Day event, pursuing a rare disease proclamation for your local municipality. We really want to make sure that everybody can get involved. All right, so hopefully some of you are familiar with NOR's Show Your Stripes campaign. Show Your Stripes is really our Rare Disease Day activation. We look to all of you, our community members, people impacted by rare disease, the general public, people who work professionally in the rare disease space, to show your stripes, both literally and figuratively. So literally meaning that you wear zebra stripes on and around Rare Disease Day to help kind of spark conversation and generate interest. And why, zebra stripes? Why is the zebra our mascot? It's because in medical schools in the United States, students are taught that when they hear hoofbeats, they should not expect to see a zebra. In other words, look for a more common answer, look for a horse. We know that 1 in 10 Americans is a zebra. We know that oftentimes, this is kind of the start of a diagnostic odyssey for patients. They may get diagnosed with more common conditions, or they may go down a route to explore more common conditions, but really there's something rare that's happening. And that kind of mindset just delays diagnosis and access to appropriate care, treatment, therapies, etc. So while it may not be obvious when you look at us, it's important that we show our stripes to raise awareness. We know it's oftentimes not obvious someone's living with a rare disease or impacted by a rare disease in some way. And that's why it's so important to bring visibility to our entire community by showing our stripes and participating in this campaign. And we just saw a little clip of Nordy, our mascot, showing his stripes in New York City a few years ago on Rare Disease Day. All right, so you may be wondering now, okay, great. I know I need to show my stripes. I love this opportunity to promote awareness for my community and everything that we kind of experience day in and day out. How do we do that? And I'm really happy to share that NORD is here for you to help you show your stripes. We put so much kind of energy and effort into developing resources to help you participate in this campaign as easily as possible. And I'm going to mention a few of them right now. And just as a reminder, the equity poll is still open. I'll probably close it after this slide. So if you're still thinking about what equity means for people impacted by rare diseases, please put your answer into the poll in the next few minutes. All right, so to help you show your stripes, NORD has developed a series of playbooks that are really gauged towards empowering specific audiences to leverage their networks and communities and resources to participate in the campaign. And all of these resources are available publicly on rarediseaseday.us, which is NORD's Rare Disease Day website. So for students, whether you're at the elementary, middle, high school, collegiate, postgraduate level, we have a school and campus playbook that has school curriculums in it. It has guidance on engaging your peers in social media. It has instructions and guidance on hosting events and more. We also have a community-focused playbook, and that's really a guide for celebrating Rare Disease Day in your town or in your neighborhood. These are the covers of the playbooks. You can find them again on rarediseaseday.us. And we love mascots here at NORD. So these are some mascots from the University of Arizona showing their stripes on Rare Disease Day last year. And that's a special shout out to NORD's Arizona Ambassador Mindy Burnworth, who makes so much happen in Arizona for Rare Disease Day every single year. So if you're in Arizona, I think I saw Mindy in the chat. She is your person to reach out to about getting involved. We also have a corporate playbook for companies that are interested in engaging in the Rare Disease Day campaign, and that playbook contains information on so many different engagement opportunities, ways that you can engage your staff, ways that you can engage in cause marketing or workplace giving, ways that your staff can engage in the social media campaign, opportunities to host and attend events, and more. And then all the way over here on the right, we have our Rare Disease Day Medical Community Playbook. This was a new resource that we added for the 2025 campaign, and we brought it back again for 2026. And that's a guide for celebrating rare disease at your clinic or your hospital. And I loved Rhia's emphasis on the fact that Rare Disease Day is really focused on amplifying the patient voice, and a lot of the tactics in that playbook talk about engaging your patients and really nourishing kind of the patient-provider relationship and opportunity to collaborate through Rare Disease Day. So that's a really wonderful resource. There's also some ideas for generating funding for hospital-based events that I think can be really helpful for those of you that may be in budget season that work in the clinical space. There's some good guidance that came from NORD's Rare Disease Centers of Excellence representatives. So some very kind of tactical advice there to make your events happen. And then over here, we have, again, the mascot theme. It wasn't intentional, but now that I'm talking through all my slides, there is a very heavy mascot presence. This is Nordy at Boston Children's Hospital last year with a clinician, and Boston Children's is one of our rare disease centers of excellence, and they do a wonderful event in their beautiful lobby every single year. All right, I'm going to end the poll and share the results. I know a short answer. I'm not sure what that looks like on the back end. It may be a little distracting, so I'm going to leave it there just for a moment while I go to the next slide. And I'm going to stop sharing so that way we can continue with the presentation. In addition to showing your stripes on Rare Disease Day, I think that's a really fantastic activation that you can do in person wherever you may be on the 28th or in the week leading up to Rare Disease Day. You can also do it digitally. So that's a really tangible way to get involved. Kind of going another step, another activation is Light Up for Rare. So across the world on Rare Disease Day, buildings, landmarks, monuments, places of interest all participate in illuminating their structure in the Rare Disease Day colors to shine a light on rare diseases. And these are a few buildings that participated in the 2025 Light Up for Rare campaign. On the top here, we have Terminal Tower in Cleveland, and on the bottom, we have the Theodore Roosevelt Executive and Legislative Building. And this is a grassroots effort. All of you that are here, whether you're somebody living with a rare disease, a caregiver, a member of the general public, somebody that works in industry, all of you are the people that submit these requests when you come to NORD's landing page and tell us about the structure in your community that's getting lit up on Rare Disease Day. We really do see so many different types of people driving this, and I think it's a really great way to get involved as an individual. So the best kind of roadmap for engaging a landmark in this campaign is to submit their request. So a lot of places, especially larger monuments, will have some sort of formal request process. If it's a structure in your town, it may be much more simple. So you'll need to do a little bit of research on your time to kind of identify these locations, like brainstorm them, and then figure out what their process is. Complete any applications and forms required by them. And then we really want to know, once you receive confirmation of their participation, please go to rarediseaseday.us and share with us that that your landmark is participating. That way we can put it on our map, and we can also make sure it gets on EURORDIS's map. And other people in your community who have rare disease can go and see it and take photos of it and amplify our message across social channels. And of course, you can also promote your participating landmark across your own social media. And you can even have your house participate. You can maybe start a movement just within your local neighborhood and have your home participate in Light Up for Rare. All right, moving on to advocacy. Everything that we do for Rare Disease Day is rooted in advocacy. It's a massive pillar of the campaign, and there's so many different opportunities to get involved. So I tried to simplify it, kind of streamline it as much as possible. So the first step is to become an advocate, to be an advocate on Rare Disease Day. You can do this by requesting a Rare Disease Day proclamation, attending an event, sharing your story, and engaging with your lawmakers, among many other different ways. And NORD, again, has created both opportunities and resources to make it very easy to be an advocate no matter where you work, live, and play. We want to make sure that these opportunities are accessible to everybody. So if you're interested in a Rare Disease Day proclamation, we have a few different toolkits that can help you with that. We have a governor's proclamation toolkit, a legislator proclamation toolkit, and a municipalities. So the best thing to do is to download that toolkit from rarediseaseday.us and just fill in. It's customizable and it'll download as a Word document, so you can fill in. If you downloaded the governor toolkit, for example, you could address your governor specifically, plug in your story, and request that there is a proclamation recognizing February 28th as Rare Disease Day in your state. And you can do the same with the other toolkits. It just depends on who you're going to be reaching out to. Maybe you have a personal relationship with one of your lawmakers and you'd like to use the legislator toolkit, or maybe you really want to see your town recognize Rare Disease Day. So you take that approach. Those are all available again on the resources tab of our website. The second way to be an advocate is to attend an event. NORD hosts so many events through our Rare Action Network, both virtually and in person for Rare Disease Day. Those will all make their way onto our event map on rarediseaseday.us, and they will also be on our events section of our main website, rarediseases.org. And we'll make sure all of those make their way to EURORDIS's calendar as well. Virtual events are so impactful and important. We always roll out NORD's state report card in February, so that way advocates have information on how their state ranks in our key issue areas and can use that information to advocate for improved policies no matter where they are on Rare Disease Day. So that will be happening in February, and that's a great virtual opportunity to keep your eye on and attend if possible. And the in-person opportunities are also really fruitful and very targeted. And we see so much change and positive outcomes coming from those, both from an impact perspective and from a community building perspective. And I have a few examples here that I just wanted to talk about briefly. This photo, the upper photo is a photo, again, Nordy. He is just everywhere for Rare Disease Day. He was in New York at the Capitol in Albany last year, and this is a photo of a group of advocates that we brought to the Capitol in New York for a lobby day. We were focused on the New York Rare Disease Advisory Council legislation, and in the photo, there's actually two Senators Prasad and Murray, were both present in that photo, and they presented our advocates with the Senate resolution for Rare Disease Day. And we've seen really great progress with the New York Rare Disease Advisory Council legislation since that moment. It really catalyzed engagement with that legislation, and we have some plans to do similar types of events in targeted states again. And we also have a lot of plans underway for awareness events at state capitals. And then on this, on the lower image, I absolutely love. It's from again one of NORD's state ambassadors in Pennsylvania. Her name's Christine McGarvey, and her daughter Bridget lives with an undiagnosed rare disease, and Christine herself also lives with an undiagnosed rare disease. And you can see advocacy isn't just it's not one dimensional. It's not just doesn't just have one kind of appearance or one look. It's advocacy from a legislative perspective. It's individual advocacy, being able to share your story and talk about what your needs are as a person impacted by rare diseases. And I think that this photo really exemplifies what it means to be an advocate. Bridget here, Christine's daughter, has engaged her entire class in showing their stripes and fostering inclusivity and acceptance at a really young age. And that's really so valuable. So attending an event, again, really a fantastic way to engage in the campaign. The Raising Youth Voices project that Rhia mentioned, I'm so sorry for my the Raising Youth Voices project that Rhia mentioned will be live streamed, so that's another opportunity to attend a virtual event. Another form of advocacy is sharing your stories, and NORD makes this very easy by providing template outreach letters if you'd like to share your story with lawmakers. We have digital action alerts around policy issues that are customizable so you can insert your story. Our Show Your Stripes playbooks have tons of guidance on sharing your story digitally just across your social networks. And then we have a Faces of Rare dedication wall, which is a beautiful tribute to everybody in our community. And I highly encourage you to check it out on rarediseasday.us and share if you take one action following out of this webinar, I think that is a great one to take. You can upload your photo and a brief dedication about rare diseases. You can describe your own experience, or you can make a dedication to somebody in your life who has been impacted by rare diseases. Last but not least, NORD also mobilizes advocates to meet their lawmakers and engage their lawmakers. Sometimes it's in person, like our lobby day in New York that we held last year on around Rare Disease Day. We also have opportunities for people to engage with their lawmakers virtually. So those are all opportunities to keep your eye out for in the coming months. I also wanted to include a slide for NORD member organizations and other organizations that may not be NORD members but are interested in our membership or are disease-specific organizations in our space. NORD supports and strengthens a diverse network of over 350 advocacy organizations, and collectively all of our members serve more than 500,000 rare disease patients. And I saw so many of our members on this webinar. Thank you for joining us. For Rare Disease Day, we really highly encourage you to join us in person and also join us in the digital campaign. It's a really fantastic opportunity to activate your disease-specific community and leverage all of the attention that the community has to drive progress towards some of your own goals. And Rhia shared a great example from the Alpha One Foundation. And I've seen other organizations use yours as graphics to kind of customize their call to action, whether that be learning more about a registry that your disease-specific organization just launched, or hosting a fundraiser to fuel your mission. This is just such a great opportunity to activate your community. So that's, I think, my #1 recommendation for our members. Use the awareness and use this momentum to drive progress against your specific goals. And then our call to action from NORD is to participate in programming that moves the needle for all people with rare diseases and engage in everything that we are doing to serve the community through Rare Disease Day. And this is a photo of one of our executive directors of one of our members, the Hermansky-Pudlak Syndrome Network, and her daughter, Ashley. So it's Donna on the left, Ashley on the right. They participate in Rare Disease Day programming, both as kind of representatives of HPS Network and also as individuals that care about the whole rare disease community. And this is a photo of them at our lobby day in New York last year, and they had the opportunity to advocate for the entire community and make sure that their representatives, their assemblymen and senators, know about HPS specifically. All right, I'm going to kick it into high gear because we have 12 minutes left. We've given you, Rhia and I have given you so much information. It's like, oh my goodness, there's so many different ways to get involved. So I wanted to kind of synthesize it into a checklist. So that way, when you leave here, you can kind of be grounded in very actionable, tangible next steps. So showing your stripes, whether it's in person or virtually, in February on Rare Disease Day, is kind of the key activation. Sharing your story is a really fantastic way to get involved. Lighting up for Rare, attending or planning a local event, meeting or engaging with your lawmakers, and then submitting your events and photos to NORD. We would love to know about your events, so that way we can promote them, and then we would love to receive your photos so that way we can amplify your impact across our social channels. And I want to emphasize that if you do host an event, it doesn't need to be something huge. It can be something like really small things have a massive impact. And this photo is from a very simple table that was set up at a local rec center in Georgia. And our volunteer ambassador in Georgia just had some information, our little paddles, and met people. And this is how people who don't know there's a broader rare disease community get brought into the rare disease community, and it can change their life in a really impactful way. She met multiple people that had no idea there was a broader rare disease community for them to engage with, didn't know that they had disease-specific organizations representing the condition that they are impacted by. So I highly encourage all of you to think about different opportunities to table in your state capital or in very busy public areas to reach these people that really need community and kind of set the stage for engagement beyond Rare Disease Day, because we have this moment and what we do at this moment can really have an impact for the entire calendar year. So that transitions really nicely into my next slide. As I shared at the beginning of this webinar, we want everybody to join us in celebrating Rare Disease Day, from lighting landmarks to participating in state events and social campaigns. NORD wants to meet you wherever you live, wherever you work, wherever you get your care. We want to unite all the voices in our community to drive policy, improve care, and build community. And like I said, we all have the opportunity to make real lasting changes in our community through Rare Disease Day. And I would love for everybody to walk away thinking about how they can be a catalyst in their own community for sustained change and progress. I think that this photo on the screen really exemplifies exactly that. This is an image from Arizona at the state capitol last year. The really amazing group of advocates in Arizona got a Rare Disease Day proclamation and were there in person raising awareness. And fast forward a few months, this same group was able to, through their advocacy efforts, they saw passage of their Rare Disease Advisory Council legislation in the state of Arizona. And now some of these people have been appointed by the governor to serve on the Arizona Rare Disease Advisory Council. So this is really what's possible with Rare Disease Day. It's not just about a single moment. It's about turning that single moment into a movement that fuels empathy, knowledge, and progress year over year. So I encourage all of you, we can think about how we can activate our neighbors, our friends, our coworkers, our teachers, mentors, and others in our network to hear our stories and take action, whether that be participating in advocacy, donating to fuel advances in care, research, and policy. The possibilities are really endless, and I think there's a lot of opportunity to be as creative as you'd like. And this is my last slide. As you think about how you want to share your story and the key messages of your educational events, NORD encourages you to lean into our theme of access this year. for the 2026 campaign, we want to see more access across the rare disease space. We want more access to life-saving therapies, more access to research, more access to caregiver respite programs. And that list really does go on and on. We've decided on this theme of access because there's so many priorities for NORD that we have set based on the needs of our community that are related to access. And we also feel like this theme can really be customizable to you as an individual. Like, what do you need in your life? What does more access look like to you? So with that, I have one more poll. We want to hear what access means to you. So for the people on this call who live with a rare disease, what do you need more access to so that you can have a better quality of life? For patient advocacy organizations on this call, what do you need more access to better serve your patients? And for companies on this call, what does more access mean to you when you think about how you can best serve a rare disease patient through your work? So I'm going to launch that poll now. And while you take a second to respond to the poll, I am going to pull up our Q&A, and we're going to move right into Q&A. So that way we can answer as many questions as possible. And thank you so much for being here. I really appreciate your time and the energy that you're going to put into making this movement really effective and impactful. You can reach out to the Rare Disease Day team here at NORD at rdd@rarediseases.org. All right, I'm going to stop sharing and I'm going to open Q&A. Okay, there are a lot of questions. Where to start? I'm just going to start. I think many people will be wondering this. When will the presentation be available? And how will I know to get it? Thank you for asking that. The presentation will likely be emailed out within the next week. It will be emailed to everybody that registered to attend this webinar, and then we'll also be uploading it to the homepage of rarediseaseday.us. I love this question. I have seen a billboard on Rare Disease Day. How can I do that? That's a great question. We have an amazing group of advocates in Tennessee that get a billboard outside of Nashville, multiple billboards outside of Nashville every year. I don't know if anybody from that Tennessee team is on this call and maybe can put some guidance in the chat, but I believe that they have a contact at a billboard company, and within a week or so of Rare Disease Day, they receive information on billboards that are not used and are able to access those. Or they're it's like an in-kind donation, and NORD provides the graphics and the message for those billboards. Oh, Carrie's here. Thank you, Carrie. So if anybody's interested in billboards, Carrie is our Tennessee Rare Action Network ambassador and has led that effort, has been point person on that effort for the last few years. So that's the billboard situation. Let's see. There are some questions. I think a few have come in just related to translation of this webinar into other languages. I think that there will probably be tools available on YouTube from a captioning perspective to help with translation. And Rhia mentioned that the Rare Disease Day campaign video is available in many languages. And all of EURORDIS resources for Rare Disease Day are available in many languages. So those are all on the Rare Disease Day website. Rhia, I did see some people in the chat interested in supporting translation efforts. Can you talk a little bit about what the step would be for those people that would like to volunteer their time?
That would be amazing. Really, it depends on what exactly you're looking to translate. So if you're looking to translate the video or have the video translated, it can either be translated or have subtitles or be dubbed. We're currently working on the subtitles, and dubbing will come a little bit later. But if you'd like to translate the video in any way, please get in contact. My information is in the chat, either with myself or with the team, and one of us will get back to you with the templates. If you're looking to translate any of our resources, so toolkits, posters, flyers, social media content, you can do that directly yourself through Canva. So you go to our website, there you saw all the links to Canva, you directly click on that and it will create a copy of the resource in your own Canva account. You just need the free Canva account, you don't need to pay for anything. And basically you just type your translation directly in to the resource in the text boxes that already exists where the English or whatever language you'd like to translate from is currently there. And then basically you save them as images and you send them back to us, myself and the team, and we can then put them on the website so that they're available for more people to access. I think that's it. If you discover anything else that you'd like to translate that doesn't work through either of those methods, please get in contact and we're dedicated to making things as available to as many people as possible. So don't hesitate to drop us a message.
Thanks so much, Rhia. I'll have just one more, I think, time for just one more, and it's more of a comment and a question. Well, it's really a question for all of you. This person said, given February 28th is a Saturday this year, we as an organization will be celebrating on Friday the 27th. Is anyone else doing this? If anyone in the chat has your plans solidified, please put in the chat. Are you celebrating on the 28th, the 27th? I can say from a NORD perspective, we have activities and programming really all of February, starting at February 1st and going all the way into Rare Disease Day and going into March. So I think anytime that makes sense for your organization is an appropriate time. But yeah, put it in the chat and we can see if anybody else has plans.
Hope you don't mind my jumping in on
Oh,
that,
yeah.
Darby. Just to say, yeah, of course, I mean, things happen throughout the month of Rare Disease Day every year, but I have heard a lot of chatter from different patient organizations that have spoken to me from across the globe, and I think a lot of people are having that same debate. So maybe if you do decide either way, kind of publicize your event and let people know, and maybe we'll start seeing a trend. But I think a lot of people, it really depends on the event. If it's something more advocacy related, people are kind of sticking to normal working hours and going for the Friday or even the Monday afterwards. Or alternatively, if it's something more community based, I think the tendency seems to be that people are going to go for it on the Saturday. But yeah, it'll be interesting to see, and don't hesitate to publicize your events so that people know either way.
Thanks so much. All right, with that, we are at 1:01. A huge thank you to everybody again for spending your lunch hour with us or your morning hour if you're on the West Coast. And we'll work on getting all of this information out to you in a recap email as quickly as possible. And I so look forward to partnering with you on Rare Disease Day 2026. Have a great afternoon.